Hi, this is Dr. Harris Meyer coming to you from San Francisco with another wellness moment. I'm really excited today to be introducing you to one of my massage therapists, Joseph, who's been working with me for a couple of years now, having terrific results for both my patients and for me. And the reason I'm introducing Joseph to you today is that he has just been trained and has been using a brand new technique called myokinesthetics that has been producing some really remarkable results that we're going to tell you about in a second here. But to start with, you all know that as a chiropractor, what I explain is that the body needs unrestricted flow of information from the central nervous system to the rest of the body for us to be healthy and to function properly. So if all nerve information is generated in the brain and then sent down the spinal cord, it then has to come out along these spinal nerves. The central nervous system is your brain and spinal cord. From the spinal nerve outward to every other part of the body is what we consider to be the peripheral nervous system. Well, if we have subluxation, or what we describe as a misalignment in the spine, it can put pressure on the spinal nerves, thereby restricting that nerve from functioning properly. Well, sometimes the restriction isn't only at the spinal level, it could be in the muscles out beyond the spine. And this is where Joseph's work has been coming in very effectively. In fact, I myself have been suffering with a repetitive strain injury in my right forearm for quite some time, actually for about 6 months now. And as a result of a handful of sessions with Joseph, I can tell you right now I'm about 75% back to normal, and there was nothing that was really improving it. I've been under chiropractic care and using therapy myself and not really getting the kind of response that I needed. So I'm going to have Joseph demonstrate a little bit for us and maybe give us a little explanation of what myokinesthetics looks like. So I apologize if that was not the smoothest transition. We had a little technical difficulty there for a minute, but to get back on track, we're going to now have Joseph demonstrate for you a little bit of what he's been doing for me to deal with my arm issue. And he's been working from the neck all the way down to the hand, but if you can just tell us.
Yeah, what I'm doing is trying to release the muscle tension by
activating the nerve.
Activating the nerve, exactly, that's true. And to that, the message from the brain will deliver to the muscle efficiently.
So one of the things that makes this technique different is that it has both a passive and active component. So right now what he's doing is completely passive for me. I'm not having any part in it. But in order to get the results that we want, he's then going to have me do some of the activity, just like he would have you do some of it.
Okay, can you continue doing up and down of your nerve?
Okay.
Hand
So
up.
I'm now motioning my hand, even though it looks like he's still doing it. He's really not. He's just kind of following along. And he'll use different motions, things like this, and a whole bunch of different motions, where he'll again start out passively doing it for me, and then he'll have me do it myself. And I do want to say this has really been remarkable. Like I said, the progress I've enjoyed has been tremendous, and we're working on it. We're working with some of our patients currently with it, and having great results there as well. So if you're interested and you'd like to find out more, by the way, we're using this in conjunction with chiropractic care, and that's really the best way to go about this. Please call our office if you'd like to try a session with Joseph, or if you'd like to find out more. You can reach us at 415-956-3226, or check us out on the web at www.bodyfocushealth.com. Thank you, Joseph.
Thank you so much, Doc.
All right, thanks for watching. We'll see you next time.